Your patient is a 25-year-old female who fell from a tree while picking mangoes, has a laceration to the left leg, and complains of pains in her back. You are called to the scene. You may now go ahead with your assessment.
Is my scene safe?
Yes, it is.
BSI taking standard precautions. Mechanism of injury: patient fell from a tree about 6 to 8 feet. Is this my only patient?
Yes.
Alright, I'm going to call for ALS backup. I will now form a general impression, starting my primary assessment. Patient appears to be in her mid-20s, lying in the supine position, seems to be responsive and alert, seems to be in pain and mild respiratory distress. Alright, at this point, my partner and I will now approach the patient. So my partner, I'm going to ask him to hold C-spine. Hi, good day. I'm EMT Len. This is my partner EMT Brown. He's stabilizing your spine, holding your neck. What is your name?
Zoe Thomas.
Hi, Zoe. You know where you are now?
Yes.
Okay. What time of day is it? Day or night?
Day.
Can you tell me what happened?
Well, I was trying to climb the mango tree and slipped. I missed my footing, and I think I cut my foot when I was falling out of the tree.
Okay, alright, Zoe. Thanks for that. So we're going to try and assist you as best as we can. So, as you can see, her level of consciousness, she's alert and responsive to time, person, place, event, and her airway is clear. She's talking to me. So now I'm going to move on to my breathing assessment. Rate,
26 breaths per minute.
rhythm.
Regular.
It's just going to listen to your chest. Quality.
Lung sounds clear. No muscle use.
Okay. Depth.
Shallow.
Alright, so at this point, I'm gonna give her 10 liters of oxygen via a partial rebreather, but just before I do that, I'm going to get a pulse ox reading of oxygen and room here. Pulse ox reading?
91%.
Okay. Alright, so my partner is holding C-spine, so I'm going to go and get the oxygen, right? And I'm going to put it on. Now I will carry on with my assessment. I reach the circulation. I see that her foot is steadily bleeding from the laceration, so I'm going to press a trauma dressing down on it. I'm going to wrap with a roller bandage distal to proximal until it is completely covered. Then I'll continue with my circulation assessment. Alright? I'm going to take her pulse now. Pulse rate.
104 beats per minute.
Alright, pulse rhythm.
Irregular.
Irregular, okay. Is the pulse weak or strong?
Weak.
Alright, skin condition.
Cool and clammy.
Alright. Alright, auxiliary temperature.
36 degrees Celsius.
Okay. Alright, so at this point I'm going to perform a head to toe rapid scan for DCAP, BTLS. Alright, and at this point I'm going to ask my partner to look for any tracheal deviation at the position of the jugular vein, and then ask him to put on a C collar. Alright, C collar is on. At this point, I'd have with log roller, right, and I'd take the arms and he'll hold the head, and I ask a bystander to hold the legs and I'd roll over. Then I put one hand here to check, to do a rapid scan of the back to make sure there's no decap, BTLS. At this point, I'm going to make her a load and go patient, get her into the ambulance, do a full set of vitals, namely blood pressure, respiration, pulse ox reading, and pulse, and also assessment of pupils, PERRL assessment. Okay? Then I'm going to reassess and I'm going to ask a sample history. Hi, this is while we're in the ambulance. Hi, miss, do you have any allergies?
Just my eyes.
Okay, are you on any medication?
No.
Any past medical history and illnesses?
Illnesses, no.
Anything happened to you before, any health issues?
A few years ago, I tore a ligament in my left foot.
Okay, that's the same foot that was bleeding.
Yes.
Okay, when was the last time you ate today?
Around 9 a.m.
Alright. And even leading up, you say you slipped, you missed your foot after trying to pick a mango, right?
Yes.
Alright, so at this point, I do a secondary assessment. Right? Now, can you wiggle your toes for me? Can you feel this?
Yes.
Alright, so I'm doing pulse, motor function, and sensation. Trying to do an assessment to see if there is any spinal injury. At this point, I'll call it in to the hospital and transport her safely and continue to reassess vital signs and primary assessment every 5 minutes. Thank you.